for my nice presentation.
Welcome.
And good afternoon, Dr. Rammohan and other all the leading association members. My hearty greetings to the esteemed personalities present on the visionary platform of the Global Ayurveda Fest to speak on their ideas and proposal of the development of Ayurveda and its fraternity, the old manner Ayurveda Vision 2030. I present you my vision as an industry person, as a representative of the organized manufacturing sector in Ayurveda, representing the medicine that speaks for Ayurveda on a global platform. At present, the Ayurvedic pharma industry, comprising generic products, PP products, cosmetic, extract, and raw herbal drugs export, account for a net turnover only 50,000 crores only. The government aims to push this market 1 lakh by 2025 and at least 2 lakh crores of the 2030. The allopathy pharma industry stands at 2 lakh crores of turnover presently. The COVID-19 pandemic has been paradigm shift to the healthcare sector. While allopathy enjoys its status quo as a mainstream medicine, the general public burdened by the non-communicable disease in the cost of health and well-being have exponentially turned towards the Ayurveda system medicine, especially Ayurveda. As cited by Honorable Prime Minister during the inaugural speech of the GF, Ayurveda holds immense potential in upholding the ideas of health and wellness. The CCIM ruling that had made the practice of surgery lawful in at least 35 distinct categories by Ayurvedic practitioners had a lot of potential. The involvement of Ayurveda in public health and emergency medicine. Definitely, with a new medicine also, we can develop in Ayurvedic sector in future within a short time. In the last budget, the center has allotted 2 lakh crores of the health department, out of which at least 20% amounting 40,000 crores is expected to pumped into the AYUSH system of medicine. How and where does the industry need attention? That is my point. Let me draw your kind attention to a few initiatives that have been highly beneficial to the Ayurvedic pharma industry and some ideas where we need further engagement and investment. First, the medicine plant cultivation is a formulation sort of Ayurvedic pharma industry. The National Medicine Plant Board and State Medicine Plant Board and Biodiversity have organized this sector in a very organized manner. The commendable work being done by these bodies should be continued for the sustained availability of the good quality of Ayurvedic products in all over India. It is indeed heartening to note that today paper to the center has permitted the medicine plant cultivation under the Mahatma Gandhi National Rural Development Employment, that is Thoilorpu Paddhathi, to boost cultivation and employment. It's a good sign, sir. Thoilorpu Paddhathi, that is the rural area we can develop the road tracks. And we can save the unnecessary road tracks also. With Ayurvedic medicine enjoying a global practice, it is our intent to update manufacturing unit a CGMP standard. Every Ayurveda drug entering the open market should be manufactured according to the global standard without compromise. The Ayurveda Medicine Manufacturers Association of India, all this is the core ideal and humbly request the allocation of funds towards assistant and dispensable the technical know-how to enabling the MSME to realize the global of the CGMP standard. It has been the need of our to bring the Ayurveda Academy, University, manufacturing industry and research council it a single platform, productivity platform. The formulation of the AYUSH Export Council by the Center for the Productivity Engagement of the Academy, Industry and Research Council in a revolutionary step towards its cause in a very short time. The council also aims to bring forth the international journal for being this idea. That is also in the pipeline now. A huge gap exists between the academy and the manufacturing sector in the Ayurvedic fraternity. Ayurvedic practitioners are not educated about the meticulous manufacturing practice and quality control measure adopted by the drug manufacturer. This is a very sad condition. The curriculum should be modified to bridge this gap and bring awareness among students, graduates, PG students, and practitioners regarding the manufacturing sector. This will further enable them to contribute productivity and preserve the needs and demand for the manufacturing sector. Despite constant discussion and debate of licensing authority of Ayurveda drug still exists clubbed with the modern drug licensing authority. Often incentive to the incentives Ayurvedic materials or drug formulation and treatment principle. This makes the licensing Ayurveda drug is a very difficult process. Steps should be taken to formulate a separate drug licensing authority for the Ayurvedic drug. Efforts should be taken a case of licensing procedure and bring about transparency at each step. At present, due to the lack of awareness regarding authentic manufacturing practice in Ayurveda, most practice and rules and government then are just cut and paste version of the allopathy pharma sector. Efforts should be taken to bring the most modern development in the manufacturing process, the Ayurvedic principles of drug formulation and law-making bodies to common platform to revise these rules and regulations. The quality standards prescribed by the Ayurvedic pharmacopoeia and formularies are highly impractical and often outdated. The academy, industry, and research council should be taken this cause and urgency and formulate new standards and parameters to testify the authenticity of Ayurveda drug in the global market. The depreciation allowance in the Income Tax Act in R&D sector has been lowered from 150 to 100% for the industry. This should be reinstated to the former 150%. Regarding the Biodiversity Act, this is my last point. Until now, the Ayurveda manufacturing unit were expected only to inform the concerned authorities regarding their utilization for natural resources. Only foreign companies harvesting natural resources need to get approval, clear approval from the authorities. In this, worrying to note that this being planned to extend the approval process to regional manufacturing unit also, the present amendment. This step will prove detrimental to the industry and to the community at the large, especially Ayurveda doctors. For instance, the modern medicine drove the knowledge regarding the anti-hypertensive action for surpassing from the naturally occurring from the drug sapaganda and then manufacture is synthetically in a laboratory. However, no access benefit in sharing is expected from the modern pharma industry in this case. But we are a health people. We are producing the manufacture for only the health purpose. They are attracted unnecessarily by the Biodiversity Act. It is very sad issue, sir. Ayurveda, which is essential to inherently Indian system of medicine, should be unfairly extended. Yes, dependence on the biodiversity of country. Steps should be instant taken to ensure sustain healthy harvesting through the state nuts and medicine plan board. To conclude, Ayurveda industry indeed has immense potential to be significant contributed to a $5 trillion herbal medicine market projected for the year 2050. By this core, at least need to be addressed in a result-oriented manner to make that leap. Thank you, sir. Thank you.